Today we had another ultrasound training with Hope, one of our expectant mother gorillas. We've been working on that type of voluntary training, so the gorilla is able to present her belly to the mesh so that we're able to ultrasound it with her awake. We've been working on it since October to make it a kind of stress-free experience for her. And today we were able to get a fetal heart rate to check how the fetus is doing, make sure it's not in distress. And so that was pretty exciting. It's about 8.5 months for their gestation. For Hope, her due date's going to be probably sometime in May or early June. And Maki's going to be 2 to 4 weeks after that, hopefully. For Hope today, she's about in her 3rd trimester, what we would consider for people. So pretty far along. And so at this stage, the fetus is so big that we can't get it in one ultrasound image, which is good. So we try to get just an image of things like the head, the heart, the genitalia, things like that. In this case specifically, Hope is a little bit older. She's had 3 successful pregnancies before, but in this case, we just want to make sure everything's growing naturally in there. We want to make sure if there is a problem, we know about it prior so that we can plan. And the other thing is to kind of develop a team mentality where the veterinary staff and the keeper staff are working together and the gorillas are participating in that. We want them to feel like the veterinary staff being around is a normal routine thing for them so that they're not stressed out at all when we come up to say hi, to examine the baby, to ultrasound her. And so we've been coming up 3 to 4 times per week since about October to kind of develop that relationship. But in general, it's a pretty hands-off experience if all goes well. We are prepared in case something goes wrong, but in the ideal world, the family group, which consists of 3 females and a male, they have a normal pregnancy, they have a normal birth for both babies, and the family raises them kind of as a gorilla family should. And so ideally the keeper staff and the veterinary staff here to support, to feed, to help enrich them, but at the same time we try to take a hands-off approach so it's more natural.